One of the most common questions that we get asked as eye doctors is how do we relate vision to the very common disease of diabetes? That's a serious question that deserves a thorough answer. And it can basically be summarized in some simple parts. The first question that needs to be answered is, are you monitoring your own blood sugar? There's no way to monitor your blood sugar unless you are using a glucometer at home, and in spite of the fact that some patients' physicians do not suggest using a glucometer at home, it is imperative that you use a glucometer to know what your blood sugar is. It's impossible to feel what your blood sugar is, and you must measure it. Fortunately, we have relatively inexpensive and accurate home measuring devices that can be used. We strongly recommend that you use a device that can uh, take the blood sample from the forearm here instead of the fingertips, because the forearm has much less pain receptors than the fingertips, and therefore it takes a lot of the annoyance out of taking your own blood sugar. Do you have to take your blood sugar 4 times a day? You do not. Should you take your blood sugar a couple times a week at least? That's the minimum that you should do. And if you need to do more, you of course can. So, item one, take your blood sugar at home and either keep a record of it in writing, or if you have a glucometer that will keep a recording for it of it, that's fine. The second item is that the most powerful tool you have to control your blood sugar is not your medication, it's your diet. And a proper diet is imperative for all diabetics to use. The primary thing that a proper diet does is level your blood sugar out by the foods that you're eating. You perhaps know that there are 3 kinds of foods that a human can eat, and they're divided into carbohydrates, proteins, and fats. Each time you eat, you should eat specifically from each of these food groups. Carbohydrates can be divided into 2 kinds: those that make your sugar go up rapidly, called high glycemic carbohydrates, and those that make your blood sugar go up less rapidly, called low glycemic carbohydrates. It's very simple to tell the difference between those two. A high glycemic carbohydrate will be refined, and it will generally be white. The most common high glycemic carbohydrates are potatoes, rice, white flour, and pasta. These 4 foods produce a very rapid rise in your blood sugar when you consume them. They should be consumed in very small amounts and should always be consumed with protein and with a good fat. What are low glycemic carbohydrates? They're actually very easy to remember because they're everything that's natural and not processed by man. All fruits and vegetables are low glycemic carbohydrates. And with very few exceptions, it's very difficult to eat natural, raw, or cooked fruits or vegetables that will cause your blood sugar to rise. There are a few exceptions to these, such as bananas, but very few. The other key is you want to eat fruits and vegetables that are rich in bright colors. This is very healthy for your eyes, not just for diabetes, but for all purposes. So, the more refined a carbohydrate is, the less your friend it is, and vice versa. Fill your plate with both snacks and at meals with vegetables like beans or carrots, strawberries or blueberries, squash or cantaloupe, spinach, any type of vegetable, tomatoes that you enjoy, and your blood sugar will respond beautifully to eating these types of foods. So, to review, the 2 kinds of carbohydrates that you can consume are high and low glycemic carbohydrates, meaning that they produce a higher or lower blood sugar. The second most important food group for you to know about is proteins. Proteins are important for leveling your blood sugar out, and they should always be consumed again with any snack or meal. Um, Good quality protein always is low in fat, and protein can be meat, eggs, fish, or soy protein are common proteins that persons can eat. The final food group is fat. Fat plays a key role in controlling your blood sugar by dampening the effect of carbohydrates. It also makes you feel full. Some suggestions for good quality fats would be all nuts, avocado, olives, olive oil are best fats for you. Fats can be used in fairly small quantities, so you don't want to overdo fats when you eat, but they should always be eaten. And a good snack to keep in your house if you're a diabetic is a good supply of nuts. I hope you found this summary about diet and diabetes and how it relates to your vision to be helpful. We will be placing this on our practice website at childandfamilyoptometry.com so that you may view this again with your family or for a reminder yourself. Please know that we want you to have excellent, healthy vision and eyes until your natural death at an old, healthy age. And that's the reason we want you to follow these principles and these rules about diet.